So what are the risk factors? Why is vitamin D deficiency so common now? Why is it a problem? Why wasn't it a problem 40, 50 years ago? One of the reasons is that dark-skinned people or olive-skinned people have a lot of melanin in their skin. Melanin serves as a natural sunscreen, and it blocks 98% of vitamin D production. So dark-skinned people have to stay in the sun 3 to 10 times longer than lighter-skinned patients to produce the same amount of vitamin D. Okay, obesity. Obese people store vitamin D in their fat cells. It's not released into the blood system. Anybody who's over 70 years old, remember 90% of vitamin D is produced by the sun striking your skin. So if you're over 70 years old, you can only produce 25% of the vitamin D as a younger person. So as we age, our skin becomes less active at producing vitamin D. Breast milk only has 25 international units of vitamin D. That's almost nil or none. Medications. So if you have patients on steroid medications, transplant medications, seizure medications, HIV medications, all those decrease your vitamin D levels. Nursing home patients and prisoners have low vitamin D levels because they're usually indoors 23, 24 hours consistently, and so their vitamin D levels are very low. Vegetarians, they don't eat any meat. Vitamin D is mostly in your fatty fish, your salmon, mackerel, tuna, and so their vitamin D levels are often low. Any patient with inflammatory bowel disease, Crohn's, and ulcerative colitis have low vitamin D levels because it's an inflammatory response problem. Patients with malabsorption syndrome have low vitamin D. And if you live above the 32nd latitude, which is a line stretched all the way from Atlanta, Georgia, all the way across to Scottsdale, Arizona, which is about 3/4 of the United States, you most likely be vitamin D deficient because in the wintertime, you can't make any vitamin D because the sun, the earth rotates or tilts on its axis. So now we're in the winter, so we're getting the sun at a 45-degree angle. So if you go below the equator, they're getting the sun at a 90-degree angle now. So you can only make vitamin D when the sun is at a 90-degree angle. We're just like plants. You can't grow it in crops in the United States in wintertime. We don't make vitamin D in the wintertime. Pregnant women are usually vitamin D deficient because they're trying to feed two people. Athletes, indoor athletes, basketball players, football players, ballerinas, and gymnasts are often vitamin D deficient because they're indoors. You can't make any indoors. Even if you have a big window pane, you're looking out the window, you're thinking you get vitamin D. Windows block 98% of vitamin D production too, so looking out the window is no good either. If you wear a sunscreen, which has been around the last, 30, 40 years, 50 years ago, we didn't wear sunscreen. So sunscreen blocks 98% of vitamin D production also. So we've made a compromise with the dermatologists. They've told us we should never be outside in the sun. So we tell people, go outside 15 minutes, put it on your face, leave your arms and legs unexposed for 15 minutes, and then put your sunscreen on. Vitamin D, the season and time of day. As I said earlier, you need the sun at a 90-degree angle. As a result, we can only make vitamin D in most of the continental United States from late March through early October. So from late October all the way through March, you make zero vitamin D if you stand in the sun all day. So usually as a result, our vitamin D levels taper or goes down 20 to 30% in the wintertime. That's why people get the winter blues and colds and flus in the wintertime. Patients that have had skin grafts, they can't make any vitamin D from skin grafts from burns. If you have liver failure or any type of renal problems, they use the vitamin D deficient also. All patients with chronic kidney disease, nephrologists were the first people to put people on vitamin D. They knew way ahead. Research shows that patients with on dialysis, they get vitamin D, a decreased incidence of myocardial infarctions. Dietary, 70% of Americans are lactose intolerant. They can't drink milk. As a result, most people don't drink milk. Milk only has 100 international units in it. You'd have to drink 20 to 40 glasses of milk to get adequate amount of vitamin D from the milk. Indoor living and technology. 50 years ago, we lived in an agricultural society. Everybody worked outdoors, ladies hang clothes outside, kid plays outside. Nobody works outside or play outside anymore, and then plus we have sunscreen. So we're not getting, and people hunted and fished and gardened and did all those things that we no longer do. In the Muslim world, people that wear long clothes, burqas, and umbrellas and long coats cover the entire body are vitamin D deficient. If you have any acute illness, this is very important for doctors. This is a fact that very few doctors know. If you have acute illness, a patient comes in the hospital, whether it's trauma, pneumonia, heart attack, your vitamin D level drops 50% within the first 24 hours of acute illness. So if your vitamin D level is 30, as the government says is normal, it's going to drop down to 15. So then your patient is indoors, so they're not getting natural sunlight while they're in the hospital. So vitamin D levels often drop even more precipitously when patients are in the hospital. So what we do as a result of that, we actually rapidly increase our patients' vitamin D level, and has made a tremendous change in our patients' outcome and decrease in the hospital cost. If you have thyroid problems or parathyroid problems, the patient are often vitamin D deficient. So out of those 24 different causes, almost everybody in here have one of those factors, and that's why we're all vitamin D deficient.